Hi, thank you all for coming out for this special occasion in memory of Kathleen Hickey, one of our beloved faculty members and just beautiful person. We would love to get started with our event this evening. So if you don't mind, just make your way this way here. We're going to start this evening with a slideshow of some pictures that were provided by faculty members, the family. We want to welcome Kathleen's family here, Bill Hickey, Megan Hickey, and Caitlin Hickey, and some of her esteemed colleagues as well. We have our doctoral student, Brittany Taylor, who will play the cello for us while we watch the slideshow in memory of Kathleen. And once we watch the slideshow, then we'll start with our program, and I'll introduce Dr. Bibiano, who worked very closely with Kathleen in cardiology, and then our speaker for the evening, Dr. Ruth Masterson Creber, who was one of Kathleen's trainees when she was here as a student, and she's now full professor. So all the things that Kathleen has touched and all the growth that has come from that, and why we have so much esteem for her. And so I want to thank all of you for coming here to this evening to share in this moment and in this event with us. So with that, we'll go ahead and start the slideshow. And thank you, Brittany. Thank you so much, Brittany. That was lovely. So as you can see, Kathleen has had such a tremendous impact on many of our lives through not just work as a colleague and research, but just as a friend and a beautiful person. And as you can see from the many pictures here, she has touched so many, and we're all just, very proud to be a part of this event that will memorialize her. So it's my distinct pleasure to introduce Dr. Angelo Biviano, who is a clinical cardiac electrophysiologist. He is also the director of the Adult Cardiac Electrophysiology Program and professor of medicine at New York Presbyterian Hospital. His research interests include the treatment and management of patients with complex arrhythmias, including atrial fibrillation and ventricular tachycardia, and arrhythmias in patients with complex adult congenital heart disease, heart and lung transplant, transcatheter aortic valve replacements, and left ventricular assist devices. That's a mouthful. Dr. Biviano has expertise related to clinical trials in arrhythmia patients and has participated in several multi-center related clinical trials in arrhythmia patients and multi-center catheter ablation trials, including the NHLBI-funded catheter ablation versus antiarrhythmic drug therapy for atrial fibrillation trial. He is the recipient of a CTSA grant that evaluated the use of signal waveform analysis to localize arrhythmias in AF patients with post-ablation atrial flutters. Dr. Biviano's NHLBI K23 grant entitled Use of Waveform and Frequency Analyses to Diagnose Atrial Tachycardias After Atrial Fibrillation Ablation laid the groundwork for a series of trials and manuscripts that addressed how to improve upon the diagnostic capabilities currently available for determination of atrial arrhythmia etiologies. More recently, he has also been a major contributor and co-author in a published clinical trial, iHeart, that evaluated the effect of mobile health technology in AF patients. He is the recipient of a philanthropic grant to conduct a prospective pilot clinical trial evaluating the effect of risk factor modification in AF ablation patients facilitated by telehealth and mobile health technology. He is also currently site investigator for a phase 2 trial of a novel antiarrhythmic medication for atrial fibrillation. Kathleen worked very closely with Dr. Biviano, and we're just so happy that he agreed to come today and say a few words about Kathleen and to introduce our speaker, Dr. Ruth Masterson Creber. So please join me in welcoming Dr. Biviano.
Thank you for those kind words. As a member of the Cardiac Electrophysiology, or EP family at Columbia, it was my privilege to know and work alongside Dr. Kathleen Hickey for at least 20 years. For those of you, many of you knew her quite well, but for those of you who didn't have the luck to know Kathleen personally, allow me to tell you a little bit about her. Kathleen graduated from Hunter Bellevue School of Nursing with a BSN, and then a master's in nursing from NYU. And after a few years as a cardiac care unit nurse, about 2 or 3, including being charge nurse after a year or 2, which was probably, if you knew Kathleen, not a stretch, at North Shore, she earned her NP degree from Pace University. She joined Columbia in 1992 as both a clinical nurse practitioner and a research coordinator. And 10 years later, she earned her doctorate from Columbia, and in 2005 joined the Columbia School of Nursing as an assistant professor. Throughout this time, she continued to practice clinically in the cardiology division and rose through the ranks to become a professor of nursing here. Kathleen's research efforts, including grants, manuscripts, and leadership roles, were numerous. To highlight just a few, she was PI on an R01 grant exploring the use of mHealth in the detection of atrial fibrillation that was called the iHeart trial, as well as an R03 researching the role of cardiac heart rhythm monitoring in Latino patients in this community. She was a member of the inaugural class of the NINR's Summer Genetics Institute, as well as a Robert Wood Johnson Nurse Faculty Scholar, researching genetically based forms of arrhythmias. With that experience, she helped found the Cardiogenetics Center in our EP program, which still is running now. She served on numerous AHA panels and was elected president of the International Society on Nursing Genetics. These experiences exposed her to an international group of nurse scientists, some of whom she mentored and some of whom she received mentoring from. Her passion for seeing patients in the clinic while also applying her research skills to answer ongoing questions about them allowed her to achieve one of her primary aims, and I quote this from her CV, quote, "to inspire the next generation of nursing scholars." This short description, of course, does not do justice to the time and the love Kathleen gave to her family, her friends, her hobbies, achieving a work-life integration that we all strive for. And now I pivot to today's speaker, Ruth Masterson Creber. Dr. Masterson Creber is a professor at Columbia University School of Nursing with tenure. Her research focuses on improving quality of life for patients with cardiac conditions across the disease continuum and pioneering innovative interventions for the delivery of healthcare. Her interprofessional program of research is grounded in nursing science, epidemiology, and health informatics, and is rapidly growing and having an impact on advancing health quality for vulnerable patients across the lifespan and across the world. She has developed digital health tools to support symptom monitoring for patients with heart failure, to provide real-time personal health information back to the patients. And she is also leading the evaluation of a mobile integrated health intervention for patients with heart failure to provide evidence to support a novel healthcare delivery service using community paramedics and facilitated telemedicine with emergency medicine teams. She is also leading global, pragmatic cardiac clinical trials across over 70 hospitals in Europe, Asia, North and South America, and Australia to evaluate the impact of coronary bypass graft surgery on patients' quality of life, symptoms, and cognition. Dr. Masterson Creber received her BA and BSN from the University of Pennsylvania School of Nursing and School of Arts and Sciences, a Master's in Science from the London School of Hygiene and Tropical Medicine, a PhD from the University of Pennsylvania School of Nursing, and her postdoc fellowship from the Columbia University School of Nursing. Prior to joining or coming back to Columbia, she served as an assistant and then associate professor of population health sciences in the Division of Health Informatics and Cardiothoracic Surgery at Weill Cornell Medicine from 2018 to 2022. Since completing her training, her program of research has been funded by multiple federal agencies, including PCORI, NINR, NHLBI, NINDS, NIA, NICHD, and Fogarty Institute. She has also published over 95 peer-reviewed publications and book chapters. I will end by sharing with you an anecdote. About 2 years ago, many of Kathleen's colleagues came together to collaborate on research stemming from Kathleen's R01 iHeart study, because at this point, Kathleen was quite ill and no longer able to participate herself. Her colleagues had taken up the baton of the iHeart study and were determined to see Kathleen's efforts come full circle by publishing it on her behalf. In an email that Ruth sent to me discussing research logistics, among other things, Ruth opened by saying, and she has given me permission to read this, so, quote, "If you do see Kathleen, please send my regards and say that she has always been such an inspiration to me. Not just the way she worked so hard and was so successful in her career, but the way she valued her family, marriage, daughters, colleagues, and patients. I've also taken on the mentorship of one of her PhD mentees, Megan, who is in the audience, who is thriving and doing so well. Kathleen built such a legacy and has truly inspired so many," end quote. And it cannot be said better than that about Kathleen. I saved that message, and just a few months ago, had the chance to share it with Kathleen's husband, Bill, and their two now grown daughters, Caitlin and Megan, who are right here in the front row, at the annual EP holiday party that's hosted by Dr. Hassan Garan, who's been a mentor to us all, as well as last year's inaugural speaker. Kathleen's family, as well as many of ours in attendance today, have attended that party since you guys were small children, and we have all grown up together. And you still attend, and you're here today. As you can imagine, they were quite touched by Ruth's message. In large part, I would think, because it sums up not only many of Kathleen's defining values, but also Ruth's. Those are the characteristics that we are here to honor and to celebrate. With that, it is my privilege to introduce Dr. Ruth Masterson Creber, who will present the second annual Kathleen Hickey Endowed Lecture entitled Getting to the Heart of Mentorship, Lessons Learned from an Exemplar Nurse Scientist, Clinician, Mentor, and Friend.
Well, thank you, Dr. Biviano, for that very generous introduction. And I also just want to thank Jackie Taylor for stewarding the Kathleen Hickey Lectureship and for inviting me to give the second lectureship in her honor. It's such a privilege for all of us to come together today and honor the life and scientific legacy of Dr. Kathleen Hickey, who passed away at the young age of, I just want to make sure we get to the next page. 1 second. Oh, there we go. Who passed away at the young age of 54 on March 14th, 2021. But before we begin, I also want to acknowledge Dr. Kathleen Hickey's family, sitting here in the front row. Bill, Megan, and Caitlin, welcome. It's such a privilege to share this with you today. So I had the privilege of being one of Dr. Kathleen Hickey's mentees from 2014 to 2018 during my postdoc here at Columbia University. Her mentorship had a profound impact on my career trajectory and has been very influential on my decision-making. So it's really an honor for me to give this lecture tonight in celebration of her life and her mentorship legacy. This evening, I want to focus on her impact on her mentees, and specifically mentorship of nurse scientists. Now, I recognize that this does not represent the full scope of her mentorship. She mentored hundreds of nurses, nurse practitioners, medical students, residents, and fellows. But tonight, I'm going to focus on a few of the nursing scholars that she mentored. We have so much to learn from the life and legacy of Dr. Kathleen Hickey. But before we start, I want everyone to know what I want you to get out of this lecture today. I want you to have a sense of clarity on what a life well lived looks like. And I want everyone to take something away from her example and be inspired to live more generously. As I spoke to her mentees, what was most striking was the consistency of the feedback on her mentorship and the special impact she had on each person. So I've structured the lecture today around the themes that came up in these conversations. The first theme was that Kathleen was grounded in her identity as a nurse. As Dr. Biviano also shared, she began her career by attending Hunter College in New York for nursing. She subsequently earned her FNP and ANP, which is Family Nurse Practitioner, Acute Nurse Practitioner from PACE, a master's from NYU, and her doctorate in education from Columbia University. She then went on to become an assistant associate and full professor in nursing at Columbia University School of Nursing, all while being a very active clinician at Columbia as an NP. She also held a joint appointment in the Division of Cardiology and electrophysiology as both a family and adult nurse practitioner, and she was a Robert Wood Johnson Scholar. Her interdisciplinary research and clinical practice focused on areas of cardiogenetics, the clinical care and management of those with atrial and ventricular arrhythmias, and the prevention of cardiac death. And across her work, Kathleen modeled the very best of interprofessional collaboration. As I was reading through some of her work in preparation for this lecture, I found this article written by her in 2017 with wisdom and direction for how to build and sustain a career as a nurse scientist. And I also just want to recommend reading this article. She's the sole author of it, and it's just written in her voice, and it feels like she's talking to you in this article. But what this article focused on, how to integrate technologies and precision approaches into clinical practice, research, and education to inspire the next generation of nursing scholars. She developed a conceptual model shown here in this figure. This figure was from the paper, and I put her picture in the middle. This figure illustrates the overlapping sources in which she was able to build a career as a nurse scientist. And she lived and modeled this across Columbia, nationally and internationally. She dovetailed her research and clinical activities in a self-perpetuating loop of relationships across the medical center, and that's what one of her colleagues said. The most common theme from her mentees was that she was totally focused on questions that have clinical impact on her patients. She was always focused on patient priorities. And if you wanted to find her, you would not find her in an office thinking about ideas. She was in the clinic with her patients. Her research was solidly grounded in her clinical practice, and she encouraged her mentees to think about the clinical implications of their work and how their research questions directly impact the clinical workflow, healthcare providers, and assessments in clinical practice. Her research always touched on salient gaps in clinical care. What was remarkable about Kathleen was that she was a dynamic woman who held so many different responsibilities in tension. Her clinical, teaching, research, and mentorship. But she was able to do this because she was precise in terms of what she gave her effort to. She applied her time and attention to things that were synergistic. The clinical and the research always informed the other. So she was a model of efficiency in terms of balancing multiple priorities. With her patients, she also lived a message of holistic health. With her patients, she wasn't satisfied in just supporting them with getting a new device. Sorry, Dr. Biviano. She always went further with them. She talked to them about smoking cessation, aligning their goals to prevention, and she really lived out the American Heart Association Life's Essential 8. Her patients and her colleagues listened to her because she walked the walk, or rather, ran the race, because she was always on the move. She enjoyed her physical activity and used it to balance her high levels of endless energy. Many of her mentees separately commented on her seemingly endless energy. So if anyone has figured out her secret, please let me know later, because I'm still really curious. She also focused on patients' health literacy. She always wanted her patients to understand their treatment options. Kathleen was a lifelong learner. She was truly a lifelong learner, and that gave her the ability to be on the cutting edge of multiple fields. In her own words, nurses must keep pace with the frequent advances in healthcare and integrate novel and clinically relevant approaches to their research trajectories. This will allow nursing researchers to raise their visibility as independent investigators, increase their ability to compete for limited funding and resources, and emerge into new areas of inquiry. One example of this passion for lifelong learning was her participation in the NINR Summer Genetics Institute in 2009. Though she had a lot of reasons to say no to this opportunity, which include moving to DC for a few months, as a busy clinician, researcher, educator, and young mother, she didn't. She said yes, and she learned an enormous amount from these experiences that went on to shape her future impact. By the way, she also would always write up her experiences in different papers. Now, many of us aspire to do things like this, but she and never get around to it, but she always did. But you'll see that this is the theme. She was a true educator. When she learned anything, she turned it around and wanted to share it with others. So to be on the cutting edge of one field is remarkable, but to be able to bridge multiple fields is exceptional. Kathleen was doing digital health long before it was popular to do so, and she became the nation's foremost leader in cardiogenetics applied to nursing practice and research. Much of her work was funded by the National Institute of Nursing Research. Her federal grant awards included an R01 and an R03. She was also nominated to become an ambassador through the Friends of the National Institute of Nursing Research. The goal of this program was to educate congressional leaders on the high-impact, cost-effective, and quality-of-life enhancing research coming out of nursing science. There was no one better to do this than Kathleen. She would take the train down to DC and go and meet with policymakers about the importance of funding nursing research. And she represented nurses who were both on the cutting edge of research and clinical practice, and she could talk to policymakers about how she was using this research in her clinics. She was also the PI of the iHeart trial, funded by the National Institute of Nursing Research. This was the first prospective randomized control trial to evaluate whether EKG monitoring with the AliveCore device in the real-world setting would improve time to detection and treatment of recurrent AFib. In addition, the iHeart study evaluated the impact of behavioral-altering motivational text messaging, all based on American Heart Association's Life Simple 7 at the time, which became Life's Essential 8. That these were sent to patients' smartphones targeting cardiac risk factors known to be associated with AFib. The study also evaluated difference in self-reported quality of life. When Kathleen could no longer lead the study, Dr. Bakken, also here, stepped in to finish the work, ensure that each of the mentees that Kathleen had mentored and invested in could see the work through. Here are 3 examples of how one grant provided multiple opportunities for mentees, such as Dr. Tercio, Dr. Caceres, Dr. Kolick, to publish important papers focused on phenotypes of engagement with AliveCore for heart rhythm monitoring, the impact of monitoring on quality of life, and the association between mental health outcomes and cardioversion among patients with AFib. She and Dr. Bakken also led the Precision and Symptom Self-Management Center, and she used this opportunity to mentor mentees in biobehavioral and genetics methods. This was one of several centers across the nation funded by NINR that was essential to training and mentoring the next generation of nursing scholars in genetics. Her focus, Dr. Caceres and Dr. Kolick were 2 of the many mentees who were mentored through the PRISM program. Her focus on cardiogenetics started after she participated in the NINR Summer Genetics Institute, and she was part of the core cohort that went on to becoming leaders in bringing genetics into nursing practice and research. But just 5 years later, she went on to become the president of ISONG, which is the International Society of Nurses in Genetics. ISONG provides a professional home to nurses conducting investigations in all areas of health, from quality of life to epigenetics, as well as how genes impact depression, anxiety, and multiple behaviors. In 2021, she was awarded the Past President Award by ISONG. One of her accomplishments during her tenure as ISONG president was to promote essential genetic competencies for nursing and be actively engaged in the blueprint for nursing genetics and genomics. She also mentored future leaders like Dr. Polly Joseph, shown here, who is a nurse practitioner and a nurse scientist in genetics now at NIH with a large program of research. But she didn't stop here with iSong. She wanted to translate this information back to all healthcare professionals and patients. She used her leadership roles, not only in iSong, but in the American Heart Association, to educate health professionals on increasing literacy in cardiovascular genetics and on basic concepts and applications of genetics and genomics for clinicians. Once again, she was a true educator. Everything she learned, she passed on to others. One of the reasons why is that she saw genetics as a powerful tool for changing healthcare and changing nursing. She wanted nurse practitioners to master taking comprehensive 3-generation family pedigrees, recognizing signs and symptoms of genetic conditions, ordering diagnostic and genetic tests, providing counseling and education, and communicating genetic risk appropriately to her patients. She was a trailblazer in nursing genetics work. She became passionate about exploring the roles that genes play in susceptibility to disease and inheritance across the lifespan. For instance, the detection of certain genetic biomarkers provides insight into which patients might be more susceptible to developing rare conditions. At this time, the Division of Cardiology was developing a clinical program incorporating precision medicine into cardiology. With Dr. Garan and Dr. Viviano, she helped to develop the Columbia program and she helped expand it nationally and internationally. She visited international scholars in the Netherlands to learn from them and to bring that knowledge back to Columbia. As with all of this, she did this because she saw the impact that this would have on patient care. In her clinical work at Columbia, she was often the first member of the healthcare team to interact with patients and families who had inherited cardiac disease. As a team-based approach is beneficial for diagnosing and treating cardiomyopathy, her role as a nurse practitioner was critical in helping patients understand the complex language of genetics and genomics. Kathleen Hickey was highlighted in this book, which is a workshop summary from 2014 on a roundtable on translating genomic-based research for health at the Institute of Medicine. In this book, she shares a case study, which I'm going to share with you because I think it captures a day in the life. It was a case study of an otherwise healthy woman in her 20s who suffered an out-of-hospital cardiac arrest, despite having no cardiac history or family history. The patient's EKG, echo, and other tests were unremarkable, as was a genetic panel for sudden cardiac arrest arrhythmia. Kathleen said she was young. She was planning her wedding. She wanted answers as to why she had this cardiac arrest. Whole exome sequencing revealed a rare variant, and after widespread database searches, the team identified 2 other individuals with the same variant who were diagnosed with idiopathic ventricular fibrillation. That helped us in her care management, she said, and the patient underwent placement for an ICD. So this is just a small case that represents, probably a morning for Kathleen in clinic. But in her own words, nurse practitioners are critical in this role because they're often the ones to hear a lot of additional details from patients, such as episodes where a patient passed out but didn't think it was important enough to tell a physician. On a personal note, I had a rare privilege of seeing this teamwork firsthand. I had a close friend whose mother died in her early 40s of a sudden cardiac arrest. And my friend, who was a young mother at the time, came to Columbia to have a full genetic workup because she was concerned that she might carry the same gene. So she called me and asked me if I would attend her appointment with her, just as a friend, just for support. So I said, sure. So I was in the clinic room, and in walks Kathleen, who of course is also my mentor here at Columbia. This was during my postdoc. I think she and I were both just as surprised to see each other in the exam room. But it was amazing to see her in action and to see the deep empathy that she had for her patients and their families, and the way that they could really confide in her about some of their deepest fears about, this happening to them, and about, leaving her children. So it was just really beautiful for me to be able to see the way that she cared so deeply for her patients. And that was because of Kathleen's value on relationships. Kathleen's strength of relationships was something that all of her mentees and colleagues talked about. From one of her colleagues, she had so much talent, and human relationships were at the center of it. It was inspiring to see someone who was so successful and so busy still appreciate and nurture the human element of relationships. We were like extended family to one another. As we could see from the beautiful pictures in the slideshow, she always put family first. It was the most important thing. She shared a lot about her family, Bill, her daughters, Megan and Caitlin, who were the light of her life. She was also part of a much larger family's ecosystem, and her deep connectedness with others grounded her with confidence. She was thus generous with her own relationships. She was quick to connect people working in the same area. She wanted people to get connected, not so she could stay at the center of those connections, but that she could help them build a web of their own connections. She made herself available. When I invited her for dinner, she came. When I asked her if we could get coffee or lunch, she was there, eager to provide mentorship, guidance, and new ideas. She was such a giver in terms of her time and effort. All her mentees talked about her availability. Her mentorship style was flexible and unstructured, which helped mentees figure out their own questions and hone them to relevance. She also treated people equally. If you were passionate about improving patient care, doing research, or your interests were aligned with her areas of interest, she invested deeply. She mentored research assistants to go on to PhD programs, pre-med students to go to medical school, residents to get into fellowship, and fellows to become attendings. Wherever you were on the journey, she was willing to go on that journey with you, to help build skills and experience to get to that next step. Everyone was equals. It didn't matter what your background or titles were. She valued teamwork in the collective sense. Whatever your skill set was, if you could contribute, it was appreciated and respected. She also made people feel like their ideas matter, but she wasn't confrontational. She helped people find solutions that were a win-win. This attitude instilled respect for Dr. Hickey across medicine, nursing, and this entire campus. And in turn, she also expected to be treated that way as well, and she was. Now I want to highlight 3 of her mentees to demonstrate how Kathleen's program of research and mentorship has helped early career scientists grow into independence. Dr. Megan Redding-Tertio is now an assistant professor here at Columbia, and she was one of Dr. Hickey's predoctoral mentees. Dr. Tertio's dissertation research focused on understanding factors associated with sustained engagement with digital health, and Dr. Hickey sponsored her successful F31 application. Later, Dr. Tertio wrote a successful K99 ROO application, inspired by Dr. Hickey's interest in health literacy and shared decision-making. In this project, she's developing a digital decision aid that's meant to support all patients, regardless of their levels of health literacy, in understanding their rhythm treatment options. Dr. Tertia was also conducting studies on disparities in digital health use in AFib and opportunities to use digital health to support lifestyle changes in AFib. As you can see, Dr. Tertia has been influenced on multiple levels by Dr. Hickey, and it's amazing to see her taking those next steps. Dr. Billy Caceres is also an assistant professor here at Columbia University School of Nursing, and Kathleen was one of his postdoctoral mentors through the PRISM Center. His program of research uses biobehavioral approaches to identify and intervene on risk factors of cardiovascular disease in marginalized populations across the lifespan. During his postdoctoral work, he completed training in cardiovascular disease epidemiology, behavioral cardiovascular health, and LGBTQ+ health. He is also funded independently through a KO1 from NHLBI. Dr. Teresa Kolek has gone on to become an assistant professor at the University of Pittsburgh School of Nursing. She was also mentored by Kathleen through the PRISM Center during her postdoc, where she focused on mitigating symptom burden in patients diagnosed with chronic conditions using omics-based approaches. She is now working towards future biomarker discovery and clinical application to alleviate symptom burden. Once again, this is just 3 of many examples that I could have highlighted of Kathleen's impact on her mentees. Though her program of research was cut short, it truly lives on in the lives of each of her mentees. Kathleen was a mentor in the truest sense of the word. Impactful mentorship is mentorship that extends beyond life. For me, when I faced a number of different career and life decisions, I've often thought, what would Kathleen advise here? But because her priorities were so clear and her advice was so consistent with those priorities, I always knew exactly what she would advise. Her example has been a guiding light for me, not only in my research and in my career, but personally as well. After I completed my postdoc at Columbia University School of Nursing, I went on to Weill Cornell Medicine. I was in the Department of Population Health Sciences in the Division of Health Informatics. I was an assistant and associate professor there, and also in cardiothoracic surgery. Following in her footsteps, I had a very interprofessional program of research across cardiology, informatics, and nursing. And I did this because of her mentorship of me and her encouragement. However, when I was offered the opportunity to come back to Columbia as a tenured professor of nursing, I thought of Kathleen. And she was a big reason why I chose to come back, to build a cardiovascular program of research grounded in informatics here. She's given me and all of her mentees a carpe diem attitude. It's time to seize the day, because none of us know how much time we have left. She inspired me not to delay in doing something that I probably wouldn't have done at that time, in both career and relationship. Kathleen lived with that attitude, and as such, she lived a full life, full of relationships and meaning, despite having her years cut short. In her own words, early-stage nurse scientists should actively ask questions, seek training in unknown disciplines, and say no to extra responsibilities. Through the development and expansion of their careers, early nurse scientists should not forget to maintain a healthy work and life balance and celebrate their successes along the way. Nurse scientists should aim to surround themselves with motivational mentors and be unafraid of persisting and persevering in unknown areas. So with that, I want to thank my cardiac sister. That's what people called us at conferences. They would always ask us if we were sisters. I'm forever grateful to Kathleen for investing in me. investing in all of us, and giving so much to us, giving so much of herself and modeling being an impactful mentor. There is a void that's hard to fill. As one of her mentees said, the people who lost out the most were students who never had the opportunity to be in her presence. But let's learn from her example and live as she did, with meaning and purpose for each day. For our own mentees, let's be all in the way she was, engaged in research that prioritizes patients. Thank you.
It's my pleasure to add just a few words, and I'm Sue Bakken, so it was my job to finish the work. And one of the things I wanted to mention was everyone I reached out to said yes, and enthusiastically, and I was really pleased we were able to get seven papers done using the data and to finish out the iHeart study. And I also want to just mention, and it ties in with Ruth, some of the things you were saying about the seize the day attitude. I can remember we had a very, very short deadline to potentially compete for a center of excellence in symptom science. And we're on a call, and I was leading it, and everybody said, I'm too busy. You know, I said, I really think there should be a multiple principal investigator application. And Kathleen was the one that said, I'm in, let's just get it done. And so this was like over Thanksgiving. So I appreciate it. So it was such a pleasure to be able to work with her. But I was thinking about, I'm thinking about two favorite memories. And there's one that I'm sure she was texting Bill on, and on July 26, 2016, we were both speaking at the NINR boot camp in DC, but I took her to Huey Lewis in the news. And she was truly like, it was her era. She was totally rocking out. We had such an amazing time. She's like, Bill's just going to be so jealous, and I'm maybe going to text him some pictures, from this. But I figured out exactly what day it was today, and the other like seize the day of the memory is just that family vacation and hopping off those mountains in Switzerland. And I saw those videos, multiple times. And for me, also being Catholic, I just always thought she was beginning to, fly with the angels. And that's just another lovely memory. And then Dean Mundinger is going to add some words here as well.
Sue, you're a hard act to follow. I'm Mary Mundinger, and my cause to be famous is that I hired her. I loved being with her. Kathleen, you're really a remarkable person, and I thank you for being here to pay tribute to the memory of this wonderful, wonderful woman. She had a personal elegance and goodwill that graced everything she did. Her exceptional talent, her brilliance in every sphere of her accomplishments earned her respect and acknowledgement for the value of her research. It's easy to celebrate success, and Kathleen had many. And she was always humble about her part in those ventures. But of course, there were setbacks as well. And Kathleen met them with a calm resilience that was rare and wonderful. I will always remember Kathleen as a radiant and generous woman who advanced her career with a steely devotion to moving the science forward. She did so alone, And she did so with other scientists who were eager to partner with her. I miss Kathleen. I will long remember how she launched her successful career here with us, her lasting friends and still mourning colleagues. Thank you.
Thank you so much, all of you, for coming this evening and celebrating the life of a wonderful, wonderful woman, Kathleen Hickey, wonderful scientist, and just all around great friend. I want to thank you all for being so generous to support the lectureship. This is the first and only endowed lectureship named for a nurse scientist at Columbia University, and it is fitting that it's Kathleen. So we want to just thank you again for coming out and showing your support. Please stay and continue to mingle, and please help yourself to food and drink in the back here. And, again, we can't thank you enough for taking part in this wonderful event. We also want to thank the School of Nursing for generously sponsoring this endowed lectureship. I want to thank personally Sue Bakken and Mary Mundinger, who are really the committee that helped bring this all together. And I was just the instrument to do what they said. And we just, hope that you come back every year to continue to live through this legacy that Kathleen has paved here at the School of Nursing. So thank you again, and we would also like to thank the Division of Cardiology for all of their support as well. So thank you so much, and have an excellent evening.